Hello, I'm Thomas Kühlein. I'm a general practitioner and professor of general practice in Germany, and I'm the current chair of the Wonca International Classification Committee. Wonca is the World Organization of Family Physicians, and the Classification Committee has developed the International Classification of Primary Care. The International Classification of Primary Care is used in many countries and has been translated in many languages of the world. The idea behind classifications is to make possible to code and thereby to create data, to give descriptions, mostly statistical descriptions of the content of primary care. A big problem of primary care physicians is that they are working all day long, but they are not able to show other people what they have done and what the worth of their work is. The main principles of ICPC are that the ICPC can not only be used to code diagnosis, which represents the view of the doctor, but with the ICPC you can also code the reasons for encounter, the reason why the patient came to see the doctor. So there are a lot of symptoms and worries and these things in the classification, and then you can code, of course, the diagnosis or health problems, so the way the doctor would explain why the patient has the problem. And then you can also code the processes, be it therapeutic or diagnostic processes. All this is then described in so-called episodes of care, and the episode of care adds the notion of time into the documentation, because the family physician or the general practitioner is the one who is caring for patients over a long time, and it is not as in the hospital that you have one hospital stay, but you most frequently care lifelong for the patient. So the episode of care is defined as beginning with the first contact between patient and physician concerning a certain health problem of the patient, and ends with the last encounter concerning this same problem. It will be explained in more detail in a different video. Well, what's the use of the use cases? Are these data used for? And they can be used over the whole range of general practice. So it can be used for the single encounter. It can support decision making. It can support explanations. So, for example, if a patient comes to see you with a certain problem and you think that severe diseases are very rare, you can show the patients, look, I have seen so many patients, and you are worried about, let's say, cancer. But cancer is very, very rare for patients with this symptom. And you can not only tell your patient then because you have the gut feeling that it is rare, but you can show it with your data. You can work on the quality in your practice with these data. For example, you can ask, how do I care for my patients with a certain health problem? So you can work at the practice level. And you can, of course, work at a health system or countrywide level by showing how much work and how good the work is done by general practitioners in your country. So at every level of healthcare systems, these data can be used. They are easy to create. The International Classification of Primary Care is a very simple, low granular, easy to learn classification, and there are many use cases for the resulting data. Thank you very much for listening.